You know, osteoporosis is a term used by doctors to describe bones that are weak and fragile, usually due to a lack of calcium content. This can result in hip fractures or that hunchback appearance that we often see in a person's spine. Now, in Canada, osteoporosis now affects 1 in 4 women over the age of 50, so that's a very high prevalence. What happens is this: after menopause, estrogen levels drop off, and that allows calcium to leak out of bone, making the bones more vulnerable, susceptible to hip fractures and spinal compression fractures. Now, it's a problem that should be taken seriously because women's mortality rates from osteoporosis-related fractures far exceeds the combined mortality rate for breast and ovarian cancers combined. And as the population ages, the prevalence of osteoporosis is expected to increase quite dramatically. So what can you do to prevent this from happening to you or someone that you care about? Well, several studies have shown that adequate calcium intake alone is associated with lowering the risk of hip fractures by 50 to 80%. So the Osteoporosis Society of Canada recommends that for women over 50 years old that they consume 1,000 to 1,500 milligrams of calcium each day. Now, healthy foods that are a rich source of calcium include foods like low-fat yogurt, low-fat milk, sardines with the bones, canned salmon with bones, peas and beans, and dark green leafy vegetables. And you should also know this, that adequate physical activity and vitamin D are also necessary to keep calcium in bone. Your vitamin D requirement is 400 international units a day. That's about as much as you would get from a multiple vitamin supplement. Postmenopausal women should ask their doctor for an osteoporosis assessment, which is best established by a bone densitometry test. It only takes 10 minutes to perform. And if your calcium intake is low, you may want to consider using a calcium supplement. Calcium supplements like calcium carbonate and calcium citrate are the most reliable varieties. And many antacids today actually contain 200 to 300 milligrams of calcium just in one tablet, so they can suffice as a good calcium supplement. They're inexpensive and they're effective. Now, for women with existing osteoporosis, hormone replacement therapy and other drugs are available to help prevent the further weakening of bone. The point is that osteoporosis is a very preventable condition. All it takes is putting into place the right lifestyle factors and the right medical practices. So consult your physician for a complete prevention program. And until we meet again, I'll encourage you to eat smart, live well, and I know you're going to look and feel great.